very first question of part 2, which is MTP Act 1971. What is MTP? Medical Termination of Pregnancy. MTP is done as per MTP Act 1971. The MTP Act was passed on August 2, 1971 to regulate the termination of pregnancy on certain grounds. What are the indications or grounds? Therapeutic, eugenic, humanitarian, social, and environmental. So, based on these 5 grounds, MTP can be performed. Therapeutic, eugenic, humanitarian, social, and environmental. What is therapeutic? Pregnancy can be terminated if continuation of pregnancy is a danger to the health or life of the mother, like IHD, ischemic heart disease, pulmonary hypertension, accelerated hypertension, pulmonary tuberculosis, acute hepatitis, hepatocellular failure, then active peptic ulcer, acute pancreatitis, acute colitis, acute nephritis, glomerulonephritis, pyelonephritis. So these are the diseases. So if in these diseases there is danger to the mother, then and then only we can perform. Then that comes under therapeutic ground of MTP. What about so these are some of the this is the list of the diseases. Not so important, but just understand what is therapeutic ground in which you can terminate the pregnancy based if there is a danger to the health of the mother. What about eugenic? Pregnancy can be terminated if continuation of pregnancy is likely to result in gross physical handicap in the child, gross mental handicap in the child, and death of the child. So eugenic means beneficial to child, which means if there is any harm which is going to be caused after delivery to the child, then we can terminate the pregnancy. For example, viral infections like German measles, hepatitis B, chickenpox, bacterial infections, syphilis, excessive exposure to radiations, cytotoxic drugs like thalidomide, LSD, RH incompatibility, parents suffering from inheritable chromosomal disorders, parents suffering from inheritable psychiatric disorders, then these are the grounds of your eugenic ground or eugenic indication. Now, moving ahead, we are going to study about humanitarian grounds. What are those? Pregnancy can be terminated if it has resulted from rape. Okay. Social, pregnancy can be terminated if it is due to failure of contraceptive. Then environmental, pregnancy can be terminated if the environment around the mother is not healthy for the proper development of child. That is poverty, small home, already many children, and earlier child being handicapped, so requiring extra attention. So these are some of the grounds. 5 grounds basically: therapeutic, eugenic, humanitarian, social, and environmental. Then what are the requirements? MTP may be routine or in emergency. Now what are the requirements for routine MTP? Record preliminary data, written informed consent. Consent can be given by the girl herself if she is above 18 years and conscious. Otherwise, consent is taken from the guardian. MTP cannot be done at the request of only the husband of the lady. So MTP can be done only by RMP. Such RMP should have experience in obs and gynae of at least one house, job of 6 months, or should have performed or assisted 25 MTPs. The RMP should be registered with the board certifying to conduct MTP, which is usually done by civil surgeon. MTP can be done only at government hospital or a center recognized for doing MTPs. All information should be treated as professional secrets, and opinion about MTP should be based upon indications for MTP and should always be formed in good faith. For MTP below 12 weeks, opinion of one RMP is sufficient. For MTP between 12 to 20 weeks, opinion of 2 doctors is required. Beyond 20 weeks, MTP cannot be done, remember. So until 20 weeks it is fine, but beyond 20 weeks it cannot be done. Now, what are the requirements of MTP in emergency? In emergency, that is, there is danger to the life of the mother, MTP can be done by any RMP at any place at any stage of gestation, provided the opinion is formed in good faith that the MTP is essential to save the life of mother. Only on therapeutic grounds, MTP beyond 20 weeks can be done. What are the methods? MTP? 600 mg mifepristone followed by 400 micrograms of misoprostol after 2 days up to 6 weeks. MR, menstrual regulation up to 12 weeks. DNE, which is dilatation and evacuation, up to 20 weeks. And DNC, dilatation and curettage. Dilatation and oxytocin drip, amniocentesis and infusion of PGE2 or PGF2, and amniocentesis and infusion of hypertonic glucose, which is 50% or saline 20%. Extra amniotic infusion or ethacrenic lactate, which is impridil. Hysterectomy after 12 weeks and when sterilization is also to be done. So these are some of the methods for MTP. Remember, 600 mg mifepristone followed by 400 microgram of misoprostol after 2 days up to 6 weeks. Now, what are the complications? Immediate complications. Death may be due to neurogenic shock, extensive hemorrhage, perforation of vagina, laceration of cervix, laceration of uterus, laceration of bladder, laceration of bowel, incomplete abortion, and due to anesthesia. What about delayed infections, sepsis, sterility 3 to 5%, mental disorders, psychological disorders, increased chances 33% more of natural abortion. So, increased chances, that is 3% more of complications in future pregnancy, and increased chances of congenital anomalies in children. So, these are some of the complications of MTP. So this was all about our MTP 1971. In that you have to define MTP. Then you are going to write the indications or grounds, 5 grounds: therapeutic, eugenic, humanitarian, social, and environmental. Then we are going to write about indications, requirements in routine MTP, requirements in emergency MTP. Then what are the complications of MTP? Moving to next question, consent in relation to examination of victim of sexual assault. Our very first question of first part. Okay, so how we are going to examine victim of rape? Precautions while examining the victim of rape. Requisition: no examination can be conducted without a proper written request letter from investigating officer. If you are going to have proper consent or letter from IO, then and then only you'll be able to perform examination of the victim of rape. Consent: written informed consent of the girl if she is about 12, conscious and mentally stable. Otherwise, consent of guardian is taken. No court or police officer can force a girl to submit her private parts for examination by a medical officer, male or female. Identity: exact details of her identity are noted, or all preliminary data is recorded. Age: in case she states to be or appears to be less than 16, detailed examination should be done to determine her age. Female nurse: a female nurse attendant should be present throughout the examination if medical officer is a male. History: she should be encouraged to narrate the whole incident. Questions should be avoided. Then clothes should be examined for signs and struggle, stains of foreign body. Removal of clothes: no attempt should be made by MO to remove her clothes. She should be asked to herself. Remove them. Body build and mental condition should be noted. Then marks of struggle on body should be recorded. Genitals should be examined as early as possible in lithotomy, knee chest position, or in good light. Then a repeat examination is done later if she is menstruating. Then foreign body: any foreign body or stains on clothes and body are preserved for further analysis in forensic science lab. Then swabs and smears: necessary samples are collected and sent to opinion. Rape is a crime and not a medical diagnosis. So the doctor should never give opinion on whether rape is committed or not. He should opine about sexual intercourse and other findings. Very important point, that doctor is obliged to give opinion on medical diagnosis only. And since rape is not a medical diagnosis, it is a crime, doctor should always mention the presence or absence of recent sexual intercourse and should not use the word rape in his report. That is very famous question. What is Macnaughton's rule? So Macnaghton was an accused in a murder case while laboring under delusion of persecution. What is delusion of persecution? He thought that someone is going to kill him. Okay. So he shot Dr. Drummond, the private secretary of PM Sir Robert Peel in London. Verdict was not responsible by reason of insanity. Lots of discussion followed in court, 14 judge bench and parliament, and this led to the formation of rules for criminal responsibility of the insane in 1843. So because of his insanity, he was not reliable for the crime which he committed, and that led to the foundation of the Macnaghton's rule, that he was unable to know the nature and quality of his acts due to mental illness. An accused person is not legally responsible if it's clearly proved that at the time of committing the crime he was suffering from such a defect of reason, from abnormality of mind, that he did not know the nature and quality of the act and he was doing, or what he was doing was wrong. So basically, if the person at the time of committing crime is incapable of differentiating the act, whether it is right, whether it is wrong, what is the nature of act, whether it is reversible, irreversible. So if he is incapable of differentiating, then he is not held liable for the crime. This legal test has also been accepted in India. As per section 84 IPC, nothing is an offence which is done by a person who at the time of doing it, by reason of unsoundness of mind, is incapable of knowing the nature of act, or that he is doing what is either wrong or contrary to the law. So he is not held responsible. Then what is a criticism? That it rests upon absolute and misleading concept of nature of insanity, that there is no place for emotional factor or inability to control the impulse. Now it is being thought that intellectual defect, which is basis of old definition of insanity, means deficient emotional control. So allowance is made for uh, schizophrenia, post hypnotic and epileptic people also. So this is the criticism which this rule faces. But generally, as a whole, remember, you have to write about the history of this rule. Then you have to write a section which is 84 IPC. Try to find out the BNS section of 84 IPC, and you have to define it. In India also it has been accepted. So yeah, this was about your McNaughton's rule. Moving to next question, what is mentally ill person? Who is mentally ill person? Enumerate the civil responsibilities. Now what are the civil responsibilities? Generally considered in relation to management of property, contracts, then marriage, competency as a witness, validity of consent, civil rights, guardianship and testamentary capacity. So we learnt about testamentary capacity in video 1, part 1 of this video. And who is a mentally ill person, and what are the civil responsibilities? So in civil responsibilities, in general we are going to learn about 8 civil responsibilities. Number 1, management of property and body. Insane, incapable of managing his property, may be deprived of the control and management of it, and a person may be appointed by the court to manage it for him. A guardian may even be appointed to take care of his person. Number 2, contracts. Contracts made by an insane are generally invalid except if made during lucid interval, or if the other party can show that he was not aware of the lunatic's condition and that the contract was a fair one. So if the contract is made in lucid interval, considered as valid, or if the other party does not know about the condition of the person, then and then also it can be treated as a fair one. Number 3, marriage. Marriage is considered as contract and it can be declared invalid if one of the parties was insane at the time of ceremony. If insanity occurs later, it is not a ground for divorce. Number 4, competency as a witness. Insane is not competent to give evidence except during lucid interval. It is entirely on the discretion of the presiding officer of the court to decide whether or not the evidence can be given. So insane is not competent to give evidence except during lucid interval. So he is treated as a normal person in lucid interval. That is what they are trying to say. Then what is validity of consent? Consent to certain acts like operations, sexual intercourse, act causing death or grievous hurt is not valid if given by an insane or an intoxicated person. Civil rights. Rights to indulge in other civil rights such as holding a driving license, voting or holding office is lost due to insanity. What about guardianship? An insane cannot be legal guardian of a minor and also cannot adopt a child. Testamentary capacity, which is will. Testamentary capacity is defined as the capacity of a person to make a valid will. Now, a will to become valid should fulfill the following conditions. Testator should be major. Testator should, who is testator? The one who is, making will. Testator should be major. Testator should be compos mentis, that is in sound disposing mind. Testator should understand the nature and consequences of the act. Testator should give his property to whom he is giving and he has a good reason for his action. Then that he is doing it voluntarily and without undue influence, force or misrepresentation of any other person. Must sign it in presence of 2 witnesses, out of which one should be a medical man. Both the witnesses should also sign. None of the witnesses must be a beneficiary from the will. An insane can, however, make a valid will during lucid interval. Holograph will is the one in which is written by the testator in his own handwriting. A will can be made even by blind, deaf, dumb, suffering from aphasia, in poor health or in extremes of age. A will is valid even if the testator committed suicide shortly after making the will. A will should be regarded with suspicion if made just before an unnatural death. A will is invalid if made during delirium. It cannot be made during drunkenness. It cannot be made during insanity. So these are some of the points which are very important in regard to considering the validness of will. We learnt about the civil responsibilities and we learnt about the civil responsibilities of basically mentally ill person, and we also enumerated civil responsibilities and will, testamentary capacity. So remember 8 points in your civil responsibilities: management of property, contracts, marriage, competency as a witness, validity of consent, civil rights, guardianship, and insanity and murder. Insanity and murder. Insanity is a plea commonly raised in the case of murder. To avoid conviction if insane at the time of crime, to avoid trial if insane at the time of trial of the case, to avoid capital punishment if insane at the time of execution. So basically, insanity is a plea which is commonly raised in the case of murder. It may act as tool for defense. The medical officer should give his report based on his own thorough examination of the patient. The characteristics of the murder committed by an insane are: it is purposeless or motiveless, generally done upon persons held dear and sometimes on strangers, that is, there is no target to hit. Its perpetration is without any preparedness, accomplices, or secrecy. There is no selection of proper time and place. Usually, multiple murders are done. There is no attempt to destroy evidence. There is no attempt to run away. He may rather himself notify the police. So, these are the characteristics of the murder which are committed by an insane. The legal test. The legal test for insanity includes: there should be some evidence of mental disease or defect. This must exist at the time of commission of crime. It should be of such a degree that the person is unable to understand that the act is wrong or contrary to law. The criminal responsibility of an insane is judged as per the following rules. Magnoton rule, which we just read. Magnoton was an accused in a murder case. While laboring under a delusion of persecution, he shot Mr. Drummond, the private secretary of PM Sir Robert Peel in London. Verdict was not responsible by reason of insanity. Lots of discussion followed in court, 14 judge bench and parliament, and this led to the formation of the rules for criminal responsibility of the insane in 1843. So, that he was unable to know the nature and quality of his acts due to mental illness. An accused person is not legally responsible if it is clearly proved that at the time of committing the crime he was suffering from such a defect of reason, from abnormality of mind, that he did not know the nature and quality of the act he was doing, or that uh, or that or that what he was doing was wrong. This legal test also has been accepted in India. As per Section 84 IPC, nothing is an offence which is done by a person who, at the time of doing it, by reason of unsoundness of mind, is incapable of knowing the nature of the act, or that he is doing what is either wrong or contrary to the law. Criticism: that it rests upon absolute and misleading concept of nature of insanity, that there is no place for emotional factor or inability to control the impulse. Now it is being thought that intellectual defect, which is basis of old definition of insanity, means deficient emotional control. So allowance is being made for schizophrenia, post-hypnotic and epileptic. Doctrine of partial responsibility. If a person is suffering from some weakness or aberration of mind, though not completely insane, he is only partially responsible for his actions, like obsessional states, depressions, and some paranoid states. So, what are these? These are nothing but the following rules under which the criminal responsibility of an insane is judged. Number one was Macnaghten rule. Number two is doctrine of partial responsibility. Number three is Durham's rule. Accused is not responsible for the act if his act resulted from mental disease or defect. What is Curran's rule? Again, I say you. A person is not responsible if, at the time of committing the crime, he did not have the capacity to regulate his conduct according to the requirements of law as a result of his mental disease or defect. Basically, Curran's rule is modification of Durham's rule. The person is not able to, regulate his conduct. So that is nothing but Curran's rule. What is American Law Institute test? That the insane lacks the capacity to appreciate the wrongfulness of his conduct or to confirm the requirements of law. Therefore, he is not responsible for the crimes committed. Number 6. Norwegian system. No defendant considered insane or unconscious at the time of offense may be punished. So, what is Norwegian system? Basically, no defendant is considered insane or unconscious at the time of offense. What are the other pleas in a murder? In a murder, at times the defense raises one of the following as the plea to absolve him of the criminal responsibility. Number one, what are the pleas? Delirium, drunkenness, hypnotism, your impulse, and somnambulism. Even your somnolentia and automatism. There are 7 pleas which a murderer may use in order to, safeguard him. Number one, delirium. It is an acute confusional state characterized by clouding of consciousness, incoordination, disorientation, and abnormal experiences as illusions, delusions, and hallucinations. Person may have suicidal tendencies, may become impulsive, and commit murder. As he is incapable of knowing the nature of his act, he is not responsible. So in delirium, he may prove that he was in delirium, and he may be, uh, what do we say, he may be forgiven. Then drunkenness, person is not responsible for his acts if the intoxicant was given without his knowledge or against his will. Also during insanity produced due to alcoholism, that is delirium tremens, he is not responsible. Section 85 and 86 IPC. Please find out what is the BNS for 85 and 86 IPC. However, voluntary intoxication is no excuse for commission of crime. Number 3, hypnotism or mesmerism. The patient's suggestibility is very much increased and he behaves and acts as per the desire, command of the hypnotizer. He is not responsible for his actions. Hypnosis has been used to treat conditions like depression, mental disorders, as anesthetic during childbirth and dental operations, in hysterical paralysis, aphonia, and asthmatic attacks. What about impulse? Impulse is sudden and irresistible force compelling the person to the conscious performance of acts without motive or forethought. As long as the person is able to decide between right and wrong, the irresistible impulse is no defense plea. What is somnambulism? It means walking during sleep without being aware of his actions and without remembering it later. Therefore, he is not responsible for his actions. He usually leaves bed and goes away. He is not asleep, but it is in state of dissociated consciousness. EEG does not indicate awake pattern. His mental faculties are highly concentrated on one particular idea, and he may solve a problem that defied him during waking hours. Logarithmic tables have been written during somnambulism. There is no recollection of the event, rarely injures himself, may commit suicide or meet with an accident, may commit a theft or murder. Crime is not willful or premeditated. What is somnolentia or semi-somnolence? It is a state midway between sleep and waking, with the mind being in confused state. Therefore, if any crime is done, the person is not reliable. Basically, the person is not responsible, not liable. What is automatism? It is a conduct performed by a person whose consciousness is impaired, that is, in epilepsy, cerebral disease or concussion, hypoglycemia, and somnambulism. He is not responsible. So, these are the 7 pleas under which a person can be excused: delirium, drunkenness, hypnotism, impulse, somnambulism, somnolentia, and automatism. What is automatism? Epilepsy, cerebral disease, or concussions. Then, what about personality disorders? What are the features? This is the next question. So, personality disorders are psychopathic, predominantly aggressive, predominantly inadequate, and predominantly morally and emotionally deficient. So, what are personality disorders? Personality is the characteristic pattern of an individual's attitudes, behaviors, beliefs, feelings, thoughts, and values. That is, the sum of the person's emotional, cognitive, and intellectual attributes. So, 3 things are there: sum of emotions, cognitive pattern, and intellectual attributes. The person is said to suffer from a personality disorder when the behavior is inappropriate to the situation. Psychopathic personality refers to a spatial derangement of mind. The important features are lack of normal conscience, absence of normal feelings for other people like love and affection, then a tendency to antisocial impulse, failure to learn from experience and to be prevented from crime by punishment, freedom from any other form of mental disorder. The symptoms usually appear in early childhood but become pronounced in adulthood and gradually diminish in later life. Sexual perversions and crimes are common. So, this is all about your personality disorders. What is exhumation? Very important, LQ, sometimes SQ as well. What is exhumation? Definition. It is defined as a lawful disinterment or lawful digging out of a buried body. Whenever you dig out a buried body, that is called as exhumation. Indications: to settle disputes regarding identity of the deceased, to settle any suspicion of foul play or disputes regarding cause of the death. Requisition: an order for examination can only be given by magistrate and not by the police officer. Now, what is the time limit? In India and England, there is no time limit for doing exhumation. In France, it can be done only up to 10 years, in Scotland, only up to 20 years, and in Germany, only up to 30 years. What is the procedure? General precautions: identification of grave and collection of samples, identification of coffin and collection of samples, identification of body post-mortem if necessary. So, these are the procedures. So, number 1, what are the precautions you have to take? The procedure is done after proper orders only, done by medical officer in the presence of magistrate, police officer, and relations of the deceased. Should be done early in the morning to have privacy since general public does not come. and also that PM if required can be completed on the same day. Number 4, all the people should wear masks and stand in the windward direction so they do not inhale gases. No disinfectant should be sprinkled on body directly. Number 2, identification of grave and collection of samples. The warden of the cemetery confirms from the records that the deceased was buried in that grave. The exact site is known from the relatives. The grave is slowly dug out, avoiding any damage to the coffin. A sample of earth from around the coffin is collected for chemical analysis. Identification of coffin. The coffin is taken out and its plate is cleaned. The coffin is identified by the undertaker who had prepared it. The coffin lid is opened and gases are allowed to escape. A sample of coffin, clothes on the body, and earth or water in the coffin is collected for chemical analysis. Number 4, identification of the body. The body is taken out of the coffin and the body or the remains present are thoroughly examined by the relations in the presence of magistrate, medical officer, and police officer. Identity is confirmed by relations. In case of dispute, photograph is taken, fingerprints are recorded, and all the features of identification are noted. Then the magistrate decides whether the body is to be reburied or whether the PM is necessary. What is PM examination? If necessary, PM is done. All the necessary viscera are collected for examination and chemical analysis. The body is reburied. What is obscure autopsy? Obscure autopsies are those which do not show a definite cause of death, that is, in which there are minimal, indefinite, obscure, or even no positive findings at all. Example, in natural diseases, rheumatic heart disease, myocarditis, coronary thrombosis, embolism, sudden myocardial infarction, bronchial asthma, hepatocellular failure, epilepsy, neurogenic shock, etc. So in these, you are not going to write cause of death. Infections, septicemia, enteric fever, typhus fever, meningitis, encephalitis, biochemical disturbances like electrolyte imbalance, uremia, diabetes, endocrinal dysfunction, adrenal insufficiency, myxedema. Then concealed trauma, which is cerebral concussion, concealed puncture, wounds, cervical fractures. Then poisoning, delayed death, IV narcotism, obscure poison, anesthetics, and miscellaneous shock, allergy, anaphylaxis, decomposition. So everything comes under your obscure autopsy. What about negative autopsy? We'll just again read this. In obscure autopsies, what are the points? Natural diseases, infections, biochemical disturbances, endocrinal dysfunction, concealed trauma, poisoning, and miscellaneous. Now, what about negative autopsy? When gross histopathological, bacteriological, and your chemical analysis fail to reveal a cause of death, the autopsy is considered to be negative autopsy. Negative autopsy may be due to inadequate history, inadequate external examination, improper internal examination, insufficient lab examination, insufficient or poor toxicological analysis, and inefficient doctor. So in these cases, you are going to have your negative autopsies. So what was the question about? Question was about your exhumation. You have to write the definition, the indications, time limits, procedure, general precautions, identification of the grave, identification of the coffin, identification of the body, and PM if necessary. Then we also learned about the obscure autopsy and negative autopsies. Coming to next question, what are PM artifacts? Artifact is defined as a change in the natural state of the body that can be misrepresented or misinterpreted during autopsy. This may lead to wrong opinion about cause and manner of death, and artifacts may be classified as introduced before death, which is therapeutic artifacts. Then you have induced during death, that is ergonal artifacts, and PM artifacts. So in general, we are going to study about three types of your artifacts. Number 1 is your therapeutic artifact, number 2 ergonal, and number 3 PM artifacts. Number 1, therapeutic artifacts induced or introduced before death. Surgical incisions may alter wound dimensions. External cardiac massage, which is sternal fracture, rib fractures, liver laceration, spleen laceration, and lung injury. Injection marks in cardiac area may bruise the heart. Circular bruise caused by defibrillator. Bullets may be misplaced. Wound healing, artificial respiration may cause emphysema and pneumothorax. So these are some of the therapeutic artifacts. What about your ergonal, which is introduced during death? Gross bleeding, perimortem injuries, it is difficult to label them as antemortem or postmortem. Number 3, PM artifacts. Improper handling of the body, decomposition, and anthropophagy. Number 1, improper handling of the body. So fresh abrasions may be produced, fresh stains may appear, rigor mortis may be partially broken, fracture of ribs, cervical spine, or long bones may occur, contusion on occiput. Then PM lividity may become pink on keeping body in cold storage. So these are some of the PM artifacts. What about decomposition? Bloating up of features, bloody fluid in mouth, nose, etc., grooves on neck and body due to tight clothing, bluish green discoloration of intestines, gas bubbles in blood, separation of sutures of skull, peeling of epidermis, features or splits on skin. Then alcohol may be produced in body due to putrefaction of proteins and carbs. Then anthropophagy, PM injuries by ants, insects, flies, rats, cats, dogs, crows, vultures, wild animals, fish, and crabs. So these points may confuse us while examining the dead body. So that are nothing but artifacts. We have seen three types: therapeutic, ergonal, and PM. Then yeah, we learnt about anthropophagy. In PM artifacts in general, in total we are going to study about 9 artifacts. Yes, 9. So third one was anthropophagy, fourth one is by criminals, then mutilation of body, PM submersion, burning, hanging, then embalming, trocar wounds, blood oozing, fluid may interfere with chemical analysis, PM corrosion, if body lying in kerosene, gasoline or corrosives, chemical injuries and color changes appear. What about burns, cracks on skin, blisters, fractures of skull and long bones, and heat hematoma? Then during exhumation, digging tools may injure the body, presence of fungus, PM imbibation of poison in earth. Then autopsy surgeon induced. So autopsy which is surgeon induced, basically fresh fractures of skull may be caused or existing ones may extend. Then hyoid may be fractured, laceration of liver and spleen and heart. Then cuts may be caused in bowel, lungs and liver. Then blood may ooze out in cavities, improper viscera collection or preservation. So these are the points which come under your PM artifacts: improper handling of body, decomposition, anthropophagy by criminals, embalming, PM corrosion in burns during exhumation, and autopsy surgeon induced. So yeah, this was all about your PM artifacts. Moving to next question, what is negative viscera report? Write a note on negative viscera report from chemical analyzer. So we are going to solve this question at the end of the next question. Preservation of viscera for chemical analysis. Preservation is very, very important. So how we are going to collect and preserve it? For chemical analysis, it is duty of doctor, it is duty of us to collect and preserve viscera and other exhibits properly. We have to collect and we have to preserve properly. Number 1, collection. Table 33.1 outlines the guidelines for collection of routine viscera. Table 33.2 states the additional viscera and body fluids that have to be preserved in some circumstances. So yeah, we'll read this table now. Stomach is quantity, entire stomach is preserved, stomach contents entirely. Small intestine, which is jejunum, 30 centimeters in adults and up to 100 up to entire length in infants. Small intestinal contents up to 100 grams. Liver, portion containing gallbladder, 500 grams in adults and entire in infants. Kidneys, 1/2 of each kidney in adults and both the kidneys in infants. Urine, 30 to 50 ml, and blood, 10 to 20 ml. So these are the substances which we need to preserve. What are preservatives? After collection of viscera, it is important to preserve them properly with proper preservative. Following account provides guidelines for preservation of viscera and body fluids. What is viscera? What is a preservative which you will be using for viscera? Rectified spirit is used as a preservative for viscera in all cases of poisoning except the following poisons. So it is very important MCQ. In which of the poisoning you are not going to use rectified spirit? Phosphorus, alcohol, phenol, paraldehyde and acetic acid. Mnemonic is PAPA. Phosphorus, alcohol, phenol, paraldehyde and acetic acid. So it is not preserved in rectified. PAPA is not reserved in basically not PAPA, it is PAPA. It is not served in preserved in rectified spirit. The viscera are also preserved in saturated solution of common salt, which is NaCl. Preserving viscera in saturated solution of common salt is routinely practiced in India because it is economical. Obviously, salt is very cheap, right? Saturated solution of common salt is also used to preserve viscera in all poisoning cases except inorganic acid and vegetable poisoning. So you are not going to use rectified spirit in PAPA, and you'll be using you're not going to use NaCl as a preservative in inorganic acid poisoning and vegetable poisoning. Thus, the viscera can be preserved in rectified spirit or saturated solution of common salt for analysis of poisons. In suspected cases of rabies, the brain has to be preserved for demonstration of Negri bodies. Very, very important MCQ. In cases of rabies, you are going to preserve brain for what? For Negri bodies. For this purpose, 1 to 2 centimeter cube of brain is collected and preserved in 50% glycerol solution. For brain, you are going to use glycerol solution. What about body fluids? Urine. For alcohol, 30 mg phenyl mercuric nitrate for 10 ml or thymol. Basically, for urine, you are going to use thymol. So these are the additional visceras. No need to read, but still you can refer to this table. So these are the additional visceras. Main we read it already, but if you want, you may read. Then what about our collection of routine viscera at autopsy? So in this way, viscera is collected. Bottle 1 contains stomach with loop of intestine with their contents. Bottle 2 contains pieces of liver, spleen and kidneys, and bottle 3 contains blood. Yeah, so for catecholamines in hypothermia, urine preserved by hydrochloric acid. So in hypothermia body, you are going to use HCl for urine preservation. Number 3, for routine toxicology, saturated solution of NaCl or equal amount of rectified spirit is used for the preservation of urine. What about blood? But before going to blood, we'll read about preservative for urine. Boric acid 0.5 gram per 60 ml, formaldehyde 2 to 4 drops, then thymol 0.1 gram per 100 ml, and toluene enough to cover the surface so that no bacteria can invade the barrier and multiply. So what are the 4 preservatives? Either you can use boric acid, formaldehyde, thymol, or toluene. Moving ahead with blood. For volatile poisons, alcohol, ether, chloroform, hydrocyanic acid, etc., airtight container under frozen conditions without any preservative for immediate processes can be used for volatile poisons actually. For alcohol in PM blood sample, fluoride is used. For alcohol in living, 10 mg of sodium fluoride acting as enzyme inhibitor and 30 mg of potassium oxalate. Remember, NaF and potassium oxalate for 10 ml of blood. For blood grouping, blood in equal quantity with 5% solution of sodium citrate. Very, very important. For alcohol poisoning, you're going to use NaF and potassium oxalate. For your blood grouping, you'll be using sodium citrate. Then for carbon monoxide, you'll be using 1 to 2 centimeter layer of paraffin. And for oxalic acid and ethylene glycol, you're going to use sodium citrate for 10 ml of blood. So what are the preservatives? Sodium citrate, NaF, potassium oxalate, paraffin, fine. What are the preservatives? Viscera, rectified spirit or saturated NaCl, and brain for EBs, 50% glycerol solution, remember. For fluoride poisoning, you'll be using 10 mg of sodium nitrate. For DNA typing, 0.5% of EDTA. For biochemical and immunological analysis, sent in frozen condition. So yeah. Heparin and EDTA should not be used as anticoagulant in alcohol as they interfere with alcohol detection. So vitreous humor should be sent in frozen condition. So these are some points regarding blood preservation. We already read about urine preservation. Now non-detection of poison. Poison may not be detected on chemical analysis and the reasons may be. So what are the reasons under which poison may not be indicated or detected? Poison is completely metabolized in body. Poison is neutralized. Obscure poison. Delayed death after poison ingestion, decomposed body, some poisons may not be detected, defective preservation, defective analysis, and poison analyzed late. So these are the few features which leads to the non-detection of poison. And hyoid bone, medico-legal importance. So these are few questions which are again important. Write the medico-legal importance of hyoid bone, redressal mechanisms for civil negligence, ideal identification marks, and radiography of a dead body. So we'll be covering these questions in our next video. But study about negative viscera report in chemical analyzer. This was the question which was second last question of this video. So definition: a negative viscera report is a chemical examiner's report stating that no poison has been detected in the viscera and no body fluid submitted for toxicological analysis. So it is a negative report basically wherein we observe or wherein we find out the presence of no poison and no body fluids are submitted for the toxicological. So basically what they're trying to say that no poison has been detected in the viscera as well and the body fluids as well. So that is nothing but your negative viscera report. Now what are the causes? Death was not due to poisoning. Poison was metabolized, detoxified or excreted before death. Poison was present in very small amount below the detection limit. Delay in collection or improper preservation caused destruction of the poison. The poison was volatile or unstable and decomposed. Inadequate or wrong viscera were preserved and sent. The poison is not detectable by routine chemical analysis. Example, some biological toxins. So these are some of the causes in which we obtain a negative viscera report for toxins or say for poisons. Now what is the medico-legal importance? A negative viscera report does not exclude poisoning. The final opinion should be based on history and circumstances of the case, clinical feature, PM findings, histopathology and toxicological examination. It is only one piece of evidence and should be interpreted with other findings as well. So in one liner, what do we say? So what can we say in one liner? Negative viscera report, a report by the chemical examiner indicating no poison could be detected in the viscera submitted for analysis. However, it does not rule out poisoning. This is very important point. Negative viscera report does not rule out poisoning. So yes, this was about the causes, medico-legal aspects, importance, and your definition of negative viscera report for chemical analysis. It states that no poison has been detected in the viscera and the body fluids. So we have completed our session. We have completed the medico-legal aspects chapter, and with this chapter we have also completed entire Bhalani of forensic medicine and toxicology. Do let me know if you people also want Bhalani videos of community medicine, and new ideas are also welcomed. So yeah, stay tuned for new series which would be uploaded soon. And yeah, do let me know about community medicine Bhalani as well. And yes, until then, keep learning, keep growing. Bye.